Every child and youth deserves a family and patient-centered medical home. A medical home is the kind of healthcare we all want and deserve. A medical home is not a place, it is a primary care model of healthcare that includes preventive, acute, and chronic care. At the core of a medical home is a knowledgeable, compassionate, physician-led healthcare team partnering with the child's family to take care of a child or youth's health needs. The National Center for Medical Home Implementation, housed at the American Academy of Pediatrics, is a cooperative agreement between the Health Resources and Services Administration's Maternal and Child Health Bureau and the American Academy of Pediatrics. The National Center is focused on ensuring that all children and youth, with and without special health care needs, have the services and support necessary for comprehensive health care through a medical home. When every child or youth has a medical home, families partner with the healthcare providers in their child's care. They're comfortable asking questions and sharing concerns. The physician-led healthcare team listens to the concerns and needs of patients and their families at every visit, honoring their strengths, culture, and traditions. Efforts are made to understand the feelings and perspectives of the family and their child or youth. Families know that they can receive clinical support through their medical home at any time of the day, any day of the week for their children. Members of the same pediatric healthcare team are partners in the care of a child and are well known to the family, from infancy through adolescence and young adulthood. The primary healthcare team communicates with subspecialists and others that children receive care from in their community. They make decisions together, along with the family, in order to keep children and their families healthy. The team refers patients to the available community resources that can help a child and their family stay healthy. When children have a medical home, they are less likely to visit the emergency department.
I'm Dr. Calcia. I practice in pediatrics for over the past 50 years as an advocate for child health. My career as a pediatrician is to ensure that every child and youth has access to the kind of care that should be the highest standard, care that is delivered in a medical home. The medical home role should be accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective care.
At the National Center for Medical Home Implementation, our goal is to help others understand what the kind of care provided in a medical home is like, and to ensure that they have the information, tools, and resources to help them provide the kind of care that we believe truly constitutes a patient and family-centered medical home. We help healthcare teams become medical homes for their patients and families. We provide technical assistance and support to a diverse audience of medical home stakeholders. We develop and share useful tools and resources to make it less challenging for practices to become a medical home for their patients and families. We educate parents and caregivers on what to expect from the medical home and how to talk to their healthcare team to make sure that their child is getting the care they need and deserve. For more information, visit the National Center's website at www.medicalhomeinfo.org or find us on Facebook at www.facebook.com/medicalhome. We look forward to working with you to ensure that every child and youth has a medical home.